This is my most extensive narrative, going from knowing nothing about public health to getting accepted into my MPH program, to graduating and getting a prestigious community health fellowship, to then entering into the field of health philanthropy and really using that public health skill set. I don't think I've shared this story before, but I think it's very valuable for others to kind of just take and learn about the different steps, the different failures or lessons along that path, and really take the advice and action on that advice, because I think it could be very helpful, especially as we go into 2025. I was hoping to have another guest today, but 6 people have canceled in the last 2 weeks. And not to stress myself out too much, I was like, let me just share this presentation that I did for a university a few weeks back with you all. So get some value from it. I hope that you all are taking care of yourselves. There's going to be a lot more content coming out soon. So feel free to let me know if there's anyone that you would like me to interview or any topics that you'd like me to cover. But enjoy today's episode. Be sure to hit that subscribe button, share it with a friend. Greatly appreciate you all. Enjoy.
Welcome, everyone. We are recording this session, and welcome to our MPH program with the University of Bridgeport and Goodwin University. This is our Data into Policy series. And tonight we have Omari Richins, who's going to be talking to us about, things that he's done. And I'll do a brief introduction. And after that, Mr. Richins will take it away with his presentation. If you have any questions, feel free to raise your hand or put it in the chat. And at the end, we will also allow some time for Q&A. So my name is Dr. Nadine Spring. I am assistant professor and associate director for the MPH program, and we're going to go ahead and get started. So Omari Richins, is the founder of the Public Health Millennial. And this is an online resource platform that supports and creates dialogue for people to learn, navigate, and transform their public health careers. Since 2019, the Public Health Millennial has shared 210 plus stories on public health careers podcasts, created 100 plus blog resources, and supported hundreds of public health people navigating their career journeys. Omari is also the co-founder and vice president of Community at Brothers in Public Health, Inc., a national grassroots nonprofit working to increase the involvement of men in color in public health to affect change within communities of color. He also works for a health foundation in North Carolina, and that's where he's zooming in from right now. Omari holds a Master's of Public Health degree in Health Management and Policy from the University of Florida and a bachelor's degree in Biology from the University of Tampa. So let's welcome Omari here tonight, and thank you so much for accepting our invitation and joining us.
Thank you so much. It truly is my pleasure. I know we had a conversation, and as soon as we spoke about the idea, I thought, yeah, there'll be a great opportunity. So happy to present. So can you let me know if my screen is showing?
Yes, it's showing, but I can see your notes and your slides.
Is it full screen now?
There we go. Yes.
There you go.
Perfect. So Public Health Millennial, this session is on data into policy, but I really wanted to focus more on my story and my journey in public health, because I think there's a lot of value in that. And I'm happy to tie in data and policy throughout my roles and things more if you'll have questions around that. But hopefully this will be informative. This is the first time I think I've laid out my journey like this, and it was kind of sentimental going through my journey. So bear with me. So this is me. I'm Omari Richins. I am the founder and CEO of the Public Health Millennial, as Nadine said, the online platform supporting public health people. But I wasn't always Omari Richins, founder of the Public Health Millennial, nor was I anyone that knew anything about public health. So I wanted to start off with my journey from 2016. This is me when I graduated from my undergraduate degree. You can see in the caption, blessed to have gotten this opportunity and to be a graduate. Hopefully my future as bright as the sun was. It was very bright that day, as you can see me squinting. And I wanted to pause at this point and give everyone some time to just think back to 2016 and to think back where they were at that point and where they are now, and like I don't think 2016 me would even imagine all the things that I've been able to accomplish and all the things that I've been able to do. So I just want to like show appreciation for we don't know where our journey is going to go, but you have to really be true to your journey and build from there. So be appreciative of where you've come from and where you are going to be going. So I got my bachelor's of science in biology and biological science. I actually started off my collegiate journey as a pre-veterinary science major, but then shifted over more to medical sciences when I wasn't sure if I wanted to work in the US. And then I also got a minor in chemistry. Shout out to the chemistry minors. I know chemistry is very hard for me, so I'm glad that I never had to do chemistry after that. But throughout my journey, I was, as I stated, on the path to become first a veterinarian, then a medical doctor. And some of the experiences that I had during my undergraduate were really trying to prep me to kind of understand what would it take, what would the healthcare setting look like. So as you can see here, I was a patient care and pre-op, post-op volunteer for one of the hospitals while I was in my undergraduate. So I graduated in December of 2016. And as I said, I was thinking about I was planning to go into medical school. So for anyone that knows that if you're planning to go into medical school, you have to study for the MCAT. So I was spending my days and nights studying for the MCAT. And I took it actually 2 times. I don't think I've ever used it for anything, but that is a very hard exam. And kudos to anyone that's able to do that successfully. And at that point, I didn't think that it would make sense for me to apply directly into medical schools. I thought it'd be better for me to choose a Master's of Medical Sciences program, which is sort of like a 1 year initial touch into medical school. And then after that, you typically apply into medical school. So that was the path that I was thinking for myself. Okay, let me take a break from not apply directly to medical school, but build more skills and make myself a better competitive applicant for medical school. In doing that, I got rejected from one school. I should say I applied to 4 schools. I got rejected from one school. I got rejected from the second school, and I got rejected from the third school. So you could imagine, I was like, "Oh my God, what's going on here? I don't know what's going to happen with my future right now." And I was really, really in a interesting place in time. You graduate from your undergraduate degree, you have a vision for what your future is going to be, and then life takes a hold and really like shows you, okay, what is happening here? How do I get a hold of this? So as I said, I got rejected from 3 of the 4 Masters of Medical Sciences programs I applied to. At the same point in time, I was thinking, okay, what else can I do with a biology degree? I always wanted to help people, and just one day I don't know if I was doing MCAT review or whatever the case might be, but a Facebook ad actually popped up for George Washington University's MPH program. That was the first time I ever heard anything about public health in my entire life. And yeah, so I dug into it, not really understanding exactly what it was, but knowing that it had a focus on preventing illness, it had a focus on helping people, and it had a focus on um, really tackling systems issues. And didn't I still at this point in time in 2017 learning about the MPH was like, okay, I can do my MPH and I can continue on to become a medical doctor and do that. So I got accepted into the University of Florida's MPH program as well as George Washington University's program. And I also got accepted into the last Masters of Medical Sciences program that I applied to. So I had to make a decision between pursuing the Masters of Medical Sciences program and the Masters of Public Health. The Masters of Medical Science was a 1 year program. And in my mind, I was thinking that to go into a 1 year program to do like first level medical school courses while also studying for the MCAT, while also applying for schools would be a lot. And I was like, that doesn't make much sense. Let me do the Masters of Public Health. At least if I do want to pursue medical school, I will have more time to do all these things and build up myself as a competitive candidate. So I decided to go to the University of Florida. At that point in time, I was already in Florida, in Gainesville, Florida. And at that point in time as well, I should say that I was volunteering at the VA hospital in Gainesville. And I think this was probably the first start to maybe the disconnect for me and wanting to become a physician, just seeing how the VA was run and just the I don't know, the interactions that I had with physicians and other clinical staff in the hospital just didn't really seem like the type of work that I wanted to do. But neither here nor there. So I continued into the Masters of Public Health, and I chose to do a concentration in management and policy because up until this point, a lot of the work that I've done was like microbiology or wet lab types of work. So I was like, let me focus on big picture, big systems change, systems thinking type work. So I decided to pursue that concentration. And maybe 2 weeks into classes into my MPH program, I was in a like intro to healthcare management course, and we were just talking about the amount of money that the US healthcare system pays for healthcare while it has worse outcomes. And then this is when I started to learn about health inequities, which is crazy to think about. Like, you do an entire biology degree in undergrad and you have no idea about health inequities while you're wanting to become a physician. But that's neither here nor there. And that's one of the reasons I have a platform to share more about public health, because I think it's a shame that we don't know about public health and we don't know what we can do in it. Regardless, went into the program. My entire mindset was very, very changed going into this program. I was like, okay, sorry, I think I forgot the point that I was in the class, the health management class, and the I just learned about like health disparities and really understood that if I was to become a physician, that the patient that I might be treating this one day mightn't have insurance, mightn't have the socially determinants of health at home to really support their true recovery, and it wouldn't get at the systemic change that I really wanted to see. And thus my mind was set on pursuing a master's of public health. In doing this, as I said, I had no idea what public health was. And it was really a journey of me discovering what that was, what I can do in it, how I can build myself, how I can really build connections. And I was actually the only first year MPH student at the University of Florida to go to the American Public Health Association conference in my first year. And that really opened up my eyes to what public health was. That was a conference, the first conference I think I ever went to, that had 15,000 people from all different walks of public health. And I was like, wow, this is amazing that there's this entire field that is working towards the betterment of communities. And I never heard of it. And it just made me just very excited for what opportunities were to come. And I always told myself that I feel like there's a lot of opportunities in public health to kind of create your own path. And as the landscape changes, there are going to be opportunities for you to find new roles that you might never have heard of, which is kind of the case for my current role. But I'll get into that in a later slide. So 2017, some of the lessons I learned were direction is important. My direction was veterinary science, then medical science, then wanting to pursue a medical degree, then in doing that, running into public health. And I think too often we get tied down on maybe the outcome, the things that we tell ourselves. But I think when you have the direction of, okay, this is what I want to do, these are the values I try to lead with, then you're really able to learn and build experiences and really decide which path you want to decide and go forward in. Two, you have to live your life for yourself. Choosing to not pursue a medical degree was one of the hardest decisions I've had to make in my life. I remember the day exactly sitting down at the kitchen table with my dad, my mom, my sister, and just really trying to advocate for my decision not to pursue medicine. because at that point in time, that's what I've spoken about, being from a Caribbean background, parents envisioning you becoming a doctor, lawyer, etc. And this new public health thing was I guess unknown to them. But for me, I knew that this was the path that I really needed to take, and I had to advocate for myself. And it was a tough decision, tough conversation I had to have with my family, but decided to do it and cannot complain. I'm actually extremely happy that I chose this path. And all experiences have value, whether you're volunteering, whether you got an interview, whether you applied for a job and got rejected. Those are all lessons and learning experiences that you get throughout your journey. So don't devalue whatever those rejections are, because they really are a part of your journey. And I think it's important to share that. So 2018, this is second semester MPH program, summer MPH program, and the fall of the MPH program. I was a soccer football referee. It was actually kind of cool. Got to run around, watch people play soccer, and get paid for it. Enjoyed that a lot. But I think the real big thing that happened for me going into my MPH program was that I really wanted to do more leadership type work, and I really wanted to just be more involved. In undergrad, I'd probably sit at the back of classes, not really be engaged. And when I was in my Master's of Public Health program, I sat in the front of most of my classes. I was always asking questions. There was never like awkward pauses in classes, because I'd just be that person to kind of fill in the space, ask questions, follow up with confirmation. And I don't know, those kinds of things, I think from the early just kind of showed people, whether that's other students and the professors, that I don't know, about something. And then there was the public health student station, which I think really catapulted my entire career, because I applied, was able to become the president. It was very interesting. I didn't think I would win it, but I did. And from that, it opened up the doors to become a committee member for the Public Health Policy Committee, which supports the College of Public Health, and really helping them get a student perspective on what are the decisions that the college should be making. And I just like pause to say this, because even though I didn't think I would become the president, I still tossed my card in the hat. I still took that chance and opportunity. And leadership opportunities, I think, they really help you to set yourself apart, and maybe even figure out more about yourself and the types of things that you like to do or maybe don't like to do. 2018, what happened in 2018? Oh, this continued, sorry. In 2018, I got a role as a community initiatives assistant planner. And this was also the next big step, I think, in my public health career at the point in time. Took a class, I don't know what it's called, but it was based on community-based participatory research methodologies. So in that class, I was able to learn the methodologies, the theory, and how to do that. And then in this position, internship assistant planner role, I was able to implement that. And interestingly enough, the person that I was working under was the person that taught the class. So that was a nice little connection to have the teacher be the boss that helped me implement and just learn more about community health needs assessments. But really being able to develop this skill around community health needs assessment was the thing that set me up for my career now and where I am now. And I'm so grateful that I was able to develop that skill, and I really took time to develop that and have conversations and do all the minute data entry things that I really hate and I really loathe, but someone has to do it, because it really taught me a lot of the ins and outs of the community health needs assessments and allowed me to be a better public health professional. I should have put this picture before the second bullet here. But in 2018, I also traveled to Europe for the first time with my then girlfriend. And this is actually the point in time that I really dove head deep into public health and what I can do into public health. I don't know what it was, But as soon as I landed in the Netherlands, I started looking up jobs in Europe, and then that just like translated to looking up jobs in the US, in Canada. And then I started doing informational interviews and just digging so deep into like what I can do, and knowing that I had a community health needs assessment skill set, and I wanted to do at that point in time be a program director, program manager, really trying to figure out, okay, what are those roles that I can apply to, and thinking about that almost a year before actually applying for jobs. And I think that's one of the things that also set me apart from many of the people that were in my cohort, is that I don't know, I just had time to sit back and not think about school, but think about what can I envision for the future? What are the skill sets that I have? What are the roles? And who are the people that interest me? What have been their roles? I did a lot of LinkedIn stalking during this time, just going to someone's LinkedIn profile, looking at their career trajectory. If it's something that interests you, reach out to them, you ask them questions, you send them messages on LinkedIn. And that was also kind of the beginning of me learning information and building the Public Health Millennial, because I wanted direction in my career, and I feel like I didn't get it, or didn't get it to the degree that I wanted. Most of the people in my cohort were continuing on to become physicians or dentists or something of that sort. So it was really hard for me to connect with people in my cohort. Well, in my direct concentration in my cohort, generally, there were more people that were staying and wanting to work in public health, and just not having those connections, I really had to find information and learn what I can do in public health. And I think it's so important that we take time to really figure that out, because from that, I was able to work backwards to kind of find and apply myself to get the rejections as well as the acceptance to the fellowship that I'll talk about in a bit. But then I came back from Europe. I got a rural health advocacy and policy internship, and this really helped me further develop some of the skills that I wanted to around policy and advocacy. And it was also something that I was able to speak to in my interview process for the fellowship that I was able to get. So 2018, this was also the time where I was also still considering working in a healthcare administration setting. So I was looking at healthcare administration fellowships, and I want to say the first cycle opens maybe in like October or something like that. So thankfully, because I was in Europe, because I was looking into these kinds of things, I knew that this was coming up as an opportunity, and I was able to prepare. I was able to reach out to my professors and get letters of recommendation and all those things ready. I applied to, I think, four of those programs, got rejected from each of them. But once again, I think it really just taught me to be more comfortable in the interview process, and to the point of being able to interview someone that is interviewing you. So like you are also gaining information on if this would be a right fit for you in the work that you're doing. So got those four rejections. Then thankfully I was able to go to the APHA conference once again. I feel like this was more of an opportunity to really connect with the people in my cohort than actually go to APHA. And I really enjoyed that time, because one thing, if you're in an MPH program, 2 years goes by really quickly. So really enjoy those times and cherish the moments with the people in your cohort or that are around you, because you never know where you'll end up. So came back from APHA, and thankfully, while I was also in Europe, I set a bunch of I learned about fellowships, and I wanted to pursue a fellowship because I thought fellowships for me was the way to kind of fast track my career, fast track my journey. So in learning about that, I was like, okay, I'm gonna put a Google job alert for public health fellowships all across the US. So I did that, and then on one day, this fellowship for the Matsu Health Foundation in Wasilla, Alaska popped up for a community health fellow. It popped up in my inbox, and at first I thought it was like a scam. I was like, oh, this is weird, this is strange. But then researched more into it, and it was an actual position. And the position was literally asking for someone to come in and support their community health needs assessment work, and to lead a photo voice project in doing so. And as I stated earlier, that was one of the main things I worked on as an assistant planner. So it really just played directly into what I wanted to do in public health as like, okay, I want to develop this skills of community health needs assessment. I want to get a fellowship. Then there was a fellowship that was directly aligned with that work that I was doing, as well as I was able to develop evaluation skills and management of like contracts and grant making and all of this. Let me see what I have on the other side. Okay, so one other thing that I wanted to mention about me, and I guess I could go here. No, I can't go there as yet. So one other thing I wanted to mention about the me looking for the fellowship and getting the fellowship is that I applied for the fellowship. I got an initial interview for the fellowship, and then they were like, they needed someone to start like mid-semester, maybe like March or something like this. So the interviews are maybe in January. And of course, I couldn't start in March. I was in Florida and I couldn't be in Alaska at that point in time. So they disqualified me as a candidate. And I always point this out to say, like, even when that happened and I was truly so sad, I still responded and I sent a thank you message and I said, thank you for the opportunity. I appreciate it. If any other opportunities like this open up, like, let me know. Or something to that effect. And maybe 2 weeks later, I got an email back saying that they were not enough qualified candidates and that they were opening back up the fellowship and they wanted to create the start position later on, which also coincided with my with me being able to graduate. Um, so I was able to go through that process, and thankfully I was able to talk to the community health needs assessment skills I was able to build, as well as the public health leadership and just the professional development that I was doing. Because even during my time in my MPH program, I was always taking whatever free professional development opportunities there were. At the University of Florida, there was a career counseling center, and they used to have a bunch of different just random speakers, and some of them used to be very informative. So also say that to say, like, use the resources that are at your school because you're already paying for it. So like you should use it. 2018, so lessons, the least you can do is put your card in the hat. I didn't know how to become the president of the Public Health Student Association, and just the impact that I know that has had on my career and me as a leader and me being able to speak to you all confidently today. I think it's important to just, throw your card in the hat. You never know. Breaks are important to get new perspective. Breaks, play, I put all of that in there. So whether it's a vacation, whether it's hobbies that you like doing or hanging out with friends, make sure that you're making time for that, especially in public health. As I say, it's hard work and hard work is hard work. So make sure that you're taking care of yourself and building in those habits. Take on new work, build new skill sets within reason. I definitely don't want anyone to burn out or to overwork themselves, but as a young professional in public health, you really want to creates a base as wide as possible on the skill sets that you're able to perform. And from there, as you do more work, get more experience, really get your hands into things, you'll understand what you like more with skill sets you want to develop more. But continue to build skill sets and take on new projects because you never know when those projects or what those projects will lead you to. So 2019, I moved to Alaska. So I was hired into the community health fellowship position at the Matsu Health Foundation. It was a 1-year fellowship. They had the intent of actually hiring me into a full-time position. But this is why I said earlier that you never know like where the job opportunities that you are going to get will lead you to, because I had no idea what a health foundation was. I had no idea that health foundation did the work that they do. I had no idea about my current role as a program officer and just how the skill sets of a public health professional really intersect with that skill set of a program officer and how you can really apply and do that work. And I was able to learn that because I took the opportunity to go to Alaska to become a community health fellow and was able to work alongside a lot of program officers and program assistants to learn this entire new world of health philanthropy, which I think still is a very maybe new in public health people, but I've seen a lot more people with MPH degrees or public health experience being in the philanthropy field, and I think the skill sets that you possess really help in that. But regardless, was able to go to the to Alaska, was able to support the community health needs assessment work, led a photo voice project, which was really awesome because I was able to go out into Alaska community, and this is very, very rural community. Met well, did these photo voice groups and conversations with a few Native Alaskan tribes, a few. There was a Filipino organization. I was able to talk with some. I think they are called Orthodox Russians. A lot of Russians in Alaska, which was interesting to me. But they all well, the Russians didn't want to come to any of the focus groups. They're very secluded and isolated to themselves. But all in that, like, really just taught me the experience, especially being a black man in Alaska, in Wasilla, Alaska, where I don't know, it's probably like 1% of the population are black people. So, just really taught me to be humble and go into community and really understand. I think a lot of the public health principles of going in, listening, and understanding what those needs are, and just keep your eyes open, take on new work when possible. And 2019 was also the same time where when I started the Public Health Millennial, I started it as a blog under the PH Millennial. And after I created the blog, as many of you know, it's like you can't just create a blog, like no one's gonna find your blog. So I had to create somewhere for people to find my stuff. So I created an Instagram account, and that's where all of the things that I've done started from. And the idea behind the Public Health Millennial was, why did I not know what public health was until I was frustrated looking for a degree? Why did I not know, even when I got into public health, what are the options and the things that you can do in public health? And just all of those learnings, and just saying, like, if I'm having these difficulties and these questions, I can imagine that other people are having the same sorts of questions. And from that, I was like, okay, I'm gonna start this blog, start this platform, and just started sharing about my failures, about my successes, about how I got my fellowship, and it's blossomed into many things. And then also in 2019, I just wanted to show that I was also very dedicated to continuing to develop myself. As I shared earlier, I initially wanted to go into being a program manager, a program director. So I took certificates through LinkedIn. Most schools offer free. If you're a student at the school, they offer free LinkedIn Premium. I don't know, check with your school and take certificates as much as you can. Could be helpful, even if not for the certificate itself, but for the information that you get from it. I think is valuable. So lessons, always follow up in a kind manner. You never know where opportunities are going to go, anything like that. You have to be your biggest believer in you. I say it time and time again, like, life is for us to live, and no one can live your life better than you can. So try to live your best life. You can always learn more, and you can always share more. And that was kind of like the philosophy behind me starting the Public Health Millennial. Like, while I didn't know everything, I knew that I was one or two steps ahead of other people, and in doing that and sharing that, it's helpful cascade, because we all need information, and I think it's important to share. And we never know when, like, how you share something and your perspective is going to resonate with someone. So, I think it's important to share, but that's just me. So that 2020. Oh yes, the pandemic happened. The pandemic happened in 2020. That was probably one of the most isolating times in my life. Living in Alaska, thankfully I lived in a fourplex, and thankfully I had a friend down on the other side of the fourplex. But it was really tough during the initial phases of the pandemic, and I'd imagine it was tough for many of you as well. Um, but from that adversity, thankfully, I thank and shout out to anyone that knows this Public Health Millennial Career Stories podcast cover photo, because this is the OG cover that I started with, but right now it's Public Health Career. So if you know this, shout out to you, because you've been around for a while. But through that adversity of the isolation of the pandemic, as well as my partner at the time broke up with me, so like double isolation, I decided to take the informational interviews that I've been doing with people and like make a podcast out of that. Like, because why not? Because I had even more time on my hands. So that's where the podcast idea came from at the point in time. I think there are probably two other public health career focused podcasts. But really just wanted to share stories and share how people have developed in their journey in public health, and just knowing that there's literally no one way into public health. Everyone's journey is unique. Um, oh, at this point in time as well was when I was told that. So backtrack a little bit. As I said, I got the fellowship. It was a 1 year fellowship. I was supposed to get hired into a full-time position. Maybe in December of 2019, they actually gave me the papers like, hey, this is the position that you're gonna get. Evaluation officer. I think it was like 80 or $85,000, and then my boss at the time shifted out of her position. The pandemic happened, and that position just wasn't a priority. So I was like, "Oh crap!" Uh, but thankfully, I would say they extended my fellowship by 3 months, just to allow me more flexibility in looking for positions. And I furiously scoured the internet for positions and applied to many positions. And as I shared earlier, uh, oh, and as I shared earlier, can't remember what I was trying to say. I lost my train of thought, but lost a position. And oh yes, I remember. So I, as I said, I was learning from being at the Matsu Health Foundation that there were these program officer roles. But I was also learning at that point in time that these roles to become a program officer, typically you have like 5 years of experience or so. And I didn't let that detract me from applying to program officer roles. There's actually a website. I can't remember what the name is right now, but you can go to the website and you can find foundations, funding organizations all across the US. And I would literally just scour through that website and look at roles, look at positions, apply to roles that I thought that I was qualified enough for. Um, and thankfully I was able to get hired into the role that I'm in right now, and I'm very thankful for that, because the role, I want to say the requirement was 5 years of experience, and at that point in time I was 1 year out of my MPH program. So I think that also goes to show, like, apply to roles even if you don't think you qualified for them, because you never know what they see in you as an applicant. And many times, if you are the right applicant for a role, you can always grow and build the skills that they need. And also going to show from on the slide here, I was continuing to just build skills, do things on LinkedIn, learn, continue to build myself. So thankfully, I was hired. Never set foot in North Carolina, but decided to take the job, and I can't complain almost 4 years later now. Um, so lessons. Oh, one other thing that I would say. So I moved from Alaska to North Carolina. I actually drove, my mom was in Alaska, and me and her drove from Alaska to North Carolina. It was probably one of the best trips that I'd like. It's I don't know. It's something that I'm going to remember for the rest of my life, camping with my mom in the middle of wilderness, cooking out the back of my car, all these types of things. So I say that to say, like, have an emergency fund and always take off time between jobs. Yeah, when you're not a student anymore, any time off is good time off. So if you're able and if you're able to really take time off between jobs, whether that's to just relax at home or do a trip, I definitely am advocate for that because you're never going to get those types of time again most of the time. The pandemic brought a lot of bad, but also brought a lot of good. I don't think I have to overstate that to this crowd. And you may not even know the role you want in public health. And I think that's why it's important not so much to focus too much on outcomes, but focus on values and skills and really developing yourself and building yourself and seeing where that takes you. 2021 to 2023, this is a lot of what I've done in my role as a program officer. As I shared, similar to public health, I had no idea what philanthropy was, what health philanthropy was. So this has been a journey of growing and learning and deepening myself into the role and deepening and building trusting relationships with community, and also is able to start Brothers in Public Health alongside a couple of other brothers. If you have not as yet, be sure to follow us on Instagram and LinkedIn. But really with the mission, as Nadine shared earlier, to get more men of color involved in public health. I want to say the statistic is the amount of men of color that have graduated from MPH programs is 3.17% or something to that effect. So it's really disproportionate, and I think there's a lot to be said there, but I will leave that for another time. So lessons. I am still in the role that I've been hired from Alaska. Work culture is so important, especially as a person of color. I think, as I said earlier, this is hard work. Hard work is hard work, and work is always going to be work. Of course, public health, we do things that we're passionate about. We do things to improve communities, but many times it can be hard. And really finding a work culture that supports you, not only in the work that you do, but as an individual, I think is so important for your resiliency and your long-term success in public health and just in your health and life. Build stuff, whether that's organizations, nonprofits, your network, your brand, or hobbies. You know, don't get stagnant in life, no matter what. There's always things to do and learn. It doesn't even have to be anything serious. It could be crocheting, like improve your crocheting skills. And then life is for living. Too many of us, I would say, don't be a martyr to public health. The health inequities that exist today have existed before you were born, and they likely will continue to exist after you have passed away. Of course, we can do work, and we have to do work to ensure that we are providing for communities. But at the end of the day, like, don't kill yourself for this work. There is life outside of work. There is life outside of public health. And I just think that's important to say. Yeah, especially in field of public health, where it's really hard to maybe detach yourself from the work. And especially, I can imagine in the COVID pandemic, detach yourself from the news, the work, and life. So just take time to live life. It could be small things, walks, no phones, movies, whatever you like. So 2024 going forward, I was actually recently accepted into a national health philanthropy fellowship program. I'm not sure the exact. They were being a little sus about how we're about to announce it, so I didn't put the picture up here, but check me out on LinkedIn. You'll see when I'm allowed to announce that, and I'll announce it there. But as I said, just continuing to develop and learn more about myself as a professional and where I want to see my future. And at this point in my career, being at the organization for 4 years, I thought applying and doing this fellowship was the right time for me to build deeper networks, maybe create more of a national network, and just build deeper leadership skills. I know I'll be getting direct one-on-one coaching. So just really investing into myself, I think, is important. One other thing, continuing to build the Public Health Millennial. If you have not yet subscribed to the podcast, Public Health Careers, follow me on Instagram, LinkedIn, all those places. One thing that I also heavily invest in is I invest a lot into building skills around writing. I think writing is underutilized, and if you follow me on LinkedIn, you'll see a lot more of my writing utilized. But that I think it is a skill that can really transform the way you communicate, the way you do work, and really persuade people. So, I don't know where I was going with that, but just I enjoy writing and I enjoy leading writing, and just continuing to see where things grow. As I said, came into public health not really knowing what it was lucky enough to find lucky, fortunate, did the work, all those things to get myself to where I am now, and really trying to figure out what that next maybe 5 years looks like. But it is all going to be on the path of developing myself, continuing to develop my brand, and sharing. So big takeaways: be curious, enjoy life, make the life you enjoy, have direction. Life will give you the final outcome. Be reflective. Let your values drive your authentic work. We all get rejected. Don't let it keep you down for too long. You can connect with me on LinkedIn. Subscribe to my email blast. I'll be sharing some new and exciting things there sometime soon. So definitely sign up there if you've not as yet. And questions?
Thank you so much for sharing your story, Omari. You know, I was a biology major myself, and I can share that in high school, when I decided to study biology, public health was not on my radar. Public health were not terms that I was familiar with. So, you know, and I know so many other members of my cohort, we, you know, was the same thing, right? And like you shared, we studied biology, we learned chemistry, organic chemistry, physics, cells, living things, anatomy and physiology, but no one taught us health equity. You know, it wasn't until we were in public health that we learned that, and you know, the importance of social determinants of health. So I see my friend Carlene just wrote something on the chat, same here. And Carlene and I studied biology together. So thank you, Carlene, for popping that in on the chat. If anyone has any questions, raise your hands or write it in on the chat. We're happy to answer any questions for you. You guys are all quiet. Okay, no questions? Type it in the chat, raise your hand. Ndengo said, it's not a question, but it's a comment. Work is always going to be work. I needed to hear this, especially today as I was struggling between my work and my assignments that are due tonight. Thank you so much.
You're welcome.
I'd just like to say for the record that this is the second time it's come up today that there's a lot of things due on Wednesday. We may want to like move our our scheduled activities for Thursday in the future.
Okay, well, there's always spring semester. We can't change it now, but there's
Yeah.
always spring semester, and we're
We
all,
appreciate you though. We know we feel you.
This is a data into policy talk, and data drives decision, right? So if we're getting the data that Wednesday is too much, we are going to listen. It is a public health program. We'll listen. Dr. Arvasco shared, thank you for sharing your story. What an amazing journey. Shari wrote, what was the biggest motivator to forge your own path in public health?
I think for me, I came into public health not knowing what it was, so there was no path for me. So any path would have been a new path, and I didn't like the idea, or I don't know. Everyone in my program, I feel like, was focused on the CDC and stuff like it. Which there's nothing wrong with focusing on the CDC. I'll be clear about that. I think they do amazing work, and you could really build your network there. But that just wasn't my cup of tea, and I feel like it was either you're either being pushed down the CDC route, federal government route, a PhD program, or like just research, like academic type research, and none of those really stood out to me. I don't know if that was just because how the program was set up, who was in the program, but I just wanted to see what else was there. And, just didn't want to limit myself to what people were telling me. When I felt like if I didn't know what public health was, then I went to this 15,000 person conference. There's probably a lot about public health that I don't know, a lot about public health that my professors don't know. So from that, just really using LinkedIn to look at what you can do in public health, look at people who have been in public health, look at what their journeys have been, look at what their positions have been, and just know that, wow, people have done such amazing things, have changed organizations, and have such unique paths and can still make an impact in public health. So I didn't want to limit myself. And to the point of I'm very driven by maybe my values and my mission to improve the health for Black communities firstly, and I think just knowing having your values and having that focus will take you to different types of work, and in doing so, you'll develop the skill sets that really resonate with you.
Thanks for sharing that. One of the things, I like about public health is no matter what your skill sets or interests are, there are roles for you in public health. So whether it's clinical trials or data analysis or, even legal or policy, assessments, developing policy, there's so many different branches of public health that you can go into, AI algorithms and public health is going to be a huge thing coming up. So there's so many different pathways you can take in public health. You have a couple comments about, they're going to follow the Public Health Millennial, follow you on LinkedIn. You have another question from Cleopatra. What inspired the name of your corporation? Just curious. Also, I can relate coming from the Caribbean and being a biology major.
So firstly, to Shari's question, I would say don't even follow me, connect with me. That's one thing that LinkedIn has changed. So if you follow me, that means that you see things that I post, but I don't see anything that you post. If you connect with me and I accept the connection, then it's both ways. I see your profile, I see the things that you comment and you post on. So just advice to you all out there as you're looking to connect with people on LinkedIn, connect with people rather than just follow them. Inspired the name, I honestly can't remember. I just remember that I was kind of brainstorming ideas with my sister and brother, and maybe looking at what handles were available around public health. And I was a millennial, and I was like, all right, public health millennial. I just went with it. Yeah, that's other things too. I think like too many times people often overthink names and these kinds of things, but it just worked out well.
And thanks for that little tidbit on LinkedIn. I learned something myself because I've received connections and follows and I didn't know the difference. So thank you for that tidbit on LinkedIn. So definitely connect and not follow. So connect. Are there any other questions? Well, I don't have any other questions myself. So thank you so much, Omari, for joining us. We did record this for our students, and it's going to be posted, especially for the HRSA scholars. James just wrote, thank you for the helpful takeaways. So we will give you the rest of your Wednesday night to work on your assignments that are due. So thank you all, and bye.
Thank you.
Thank you so much.
Bye, everyone.